and I've been doing consulting for about 19 years this month. So been around, thank you. So what I want to do is just go around the classroom and kind of give me your name and then what you do and how long you've been doing it. That way I get an idea what my audience is.
Starting to say we all work for the same organization.
Sure.
I'm PHM Ryan. I work with SPAG and I am regional services. We do more of the grant side, that's small business, but we're here to support the other side of our department.
Okay, got you.
Okay.
So
we work with engineers a lot.
Okay, good.
Program specialist.
Okay. SPAG.
Cindy Castillo, like I mentioned, I'm more on the lending side, but I'm trying to incorporate, once we make that move to our new building, into implementing an HR department.
Okay.
With, of course, safety
practices
put in there as well.
Okay, and so what are you doing for HR now?
I only kind of brought it to Kelly's attention not that long ago, maybe about 2 to 3 weeks ago, but one thing I mentioned in my last class was that she actually listened to me because she's taking me to a Sherman conference here in a couple of weeks.
Okay.
And so, it comes up. I honestly thought, like I mentioned in my last class, I thought it was going to be something where she's like, oh, sure, never talk about it again.
Gotcha.
So,
okay.
So right now I'm just trying to look into all the resources and find a way to kind of build.
Okay, good. Sounds good. Need to get these individuals here.
Thank you.
How are you guys doing today?
Good. How about you?
We're going around and everybody's singing a song real quick, just to kind of warm up a little bit. Sometimes they say we have hidden talents. Maybe this is where you find out if you sing or not. Okay. Is that everybody? Okay. All right, and then up here.
Oh, I'm Yvonne. Work for SPAG. I'm a program specialist.
Okay.
And I've been doing it 6 months.
6 months? Okay.
Yes. I just graduated last December.
All right. Congratulations.
Just in the waters.
Okay.
Yeah.
All right. And back here, your name and what you do?
I'm sorry, I got candy in my mouth.
We'll go over here and then we'll let you kind of enjoy
My
it.
name is Kimberly Brown.
Your mind?
Oh,
Your mind?
we weren't here for the instructions, y'all.
Oh.
No, we weren't. But no.
I need your name and what you do. How long you been doing it?
So, how long have we been? 3 years?
About 3 years.
Yeah, 3 years. So we're El Roby. What we do is we help when felons first get out of jail so that they don't go back to the streets.
Okay.
We do skill training with them, so we teach them electrical, HVAC, plumbing, and pipe fitting, and we
absolutely.
do the
Great.
placements for them.
Okay.
So they can start a career path.
Great. Yeah. Okay. Well, welcome. All right, we'll get started, and we're going to talk a little bit about safety and health programs, and I hope that you guys, when y'all leave, y'all take something with you, and to where it's easier for you to understand the compliance side. I've been on both sides, so like I said, I've been doing this for 19 years, and our company does environmental engineering, and we do safety as well. So, I'm a trainer, and I've got 2 other trainers that do a lot of training. I did an MSHA training yesterday for Lubbock County, so that's another division that we do as well. So, question, so nobody's a business owner. Okay. Well, I was going to ask the question of business owners, and this was the question here. When a business owner opens a business, do you open it to fail, or do you open it to succeed? We want it to succeed, right? So, and that was a question. I actually have a formula for a sound business, and it's pretty simple. And this is probably the easiest formula you've ever seen. Safe plus healthful workplace equals a sound business. Being in this industry, a lot of times, safety. A lot of employees that you're responsible for, and it could be anywhere between 10 to 200 employees. I had a client that right now in Amarillo that has 201 employees, and that's a handful. Now, Cindy, I don't know if you'd want to handle something like that, but that's a load there for that industry. So, value of safety and health programs. Implemented a safety program. That's first. Now, a lot of companies, when they start a new business, they think they have to do the whole 9 yards, and you don't have to start that way. You can just start a little bit at a time, because a lot of times, just if we're honest with each other, small businesses, funds are limited. So, and you guys know that when you do your loans, we've got to prevent workplace injuries and illnesses. And how do we do that? Anybody know how we do that? Training. You're absolutely right. Training is the first thing that goes out the window when times get hard, and training nobody wants to do until something happens. At that point we become reactive instead of proactive. So you're right. We have to prevent those. Improve compliance with laws and regulations. Now, my advice is for all of you, and especially Cindy, since you're going to get into the HR, there's a lot of compliance that come with that. Here's the easiest way to do this. Instead of worrying about the compliance and the standards, I'm not saying you don't have to do it. What I'm saying is they're going to be there forever. OSHA has standards, MSHA has standards. There's a lot of standards and regulations out there that we have to comply with. But here's the easiest way to do that. If your employees do what you ask them to do in regards to safety, for example, safety glasses. A lot of times, I don't know if you guys have been around in the industry where, people have to wear safety glasses, and this is what you see. Is that protecting your eyes? No, it's not. So we have to make sure that they understand that the reason that they have to put safety glasses is to protect their eyes. The easiest way around this is to implement a safety program. Do the training, as you mentioned, and that way you don't have to worry so much about the compliance, because if you're keeping your employees safe, you're taking care of the OSHA regulations. I mean, that's the ultimate goal, is to keeping your employees safe. How many of you guys would like to be a business owner or a manager and be responsible for the safety and health of your employee?
We already are.
Okay. So how would you feel if, God forbid, something happened, because they didn't do something that was safety related, a requirement? How would you feel now being in charge of those individuals?
Oh, we got a whole claim.
Yeah.
Money and explanation and investigation.
Absolutely, and then time. Time is, it gets expensive. So I did that training yesterday, as I mentioned. And one of the guys that was in my training, I said, how would you like, there was a scenario that they brought up, and I'll just sum it up real fast. The employees go in there because they have to do the work, but they don't think about the hazards that exist out there. And so they just go in without thinking it. And I said, would you send your son or daughter to do that type of job? And what do you think the answer was? No, absolutely not. So why does it change with the worker? It's not hard to understand it, but it's just that we're so bogged down with work that we have to do the work and don't ever think about the way to get around it. Reduce costs. Absolutely, we need to reduce costs because workers' compensation is expensive. If you guys have insurance, it has gotten higher and higher. Everything's gotten higher here recently. Engage workers. How would you engage a worker?
In safety or?
In safety.
In safety. Maybe just lessons, maybe.
Okay.
Being interactive and telling them why this is in place.
Okay.
Examples.
Perfect.
Yeah.
Perfect. And we want to engage our employees. A lot of times, when was the last time you patted somebody on the back for doing a good job? It's always, you did this wrong, or you didn't put your safety glasses on, you didn't wear a harness, those type of things. You didn't put your seatbelt on when you were operating the forklift. We point those things out, and we should. But a lot of times we don't pat them in the back for a job well done. We have to engage our workers. Enhance social responsibility goals. We've got to do a better job at doing that. And increase productivity, enhance overall business. And that's what you'll get once you do these elements here in safety. Now, what OSHA recommends is for us to have a practice and safety program. And the way you do that is you've got to identify hazards. And a quick example, y'all guys see this extension cord in front of here? Can you imagine if that was at the door where you came in? What would be the first thing that would come to your mind? Trip hazard, absolutely. That is a recognized hazard, so now we got to do something about it. Fortunately for you guys and for me, we don't have to go in that area. It is taped down, but it's still a trip hazard. If even as an instructor, if I'm walking around and forget because I'm going to show you something and I come over here to hand it to her, I could trip and fall. I mean, it's there. How many of you guys have tripped on your own 2 feet? We do it all the time. I know I do it. On carpet. Just imagine the environment that's out there for your workers. I mean, in the mine industry, there's sand, uneven ground. I mean, even in manufacturers, the busted concrete. I mean, extension cords. I mean, you name it. Air hoses. So they're all out there. So what they want you to do is to identify the hazard, and then do something about it. That is the way you do it. Have you ever been in a workplace to where you see something and maybe you point it out and you're thinking maintenance is going to take care of it, but it's been like that for a couple of months? Have you seen that before? So we've got to identify them, but we got to do something about it. In the OSHA world, if you identify a hazard and you don't correct it and something happens, now you get fines, and now that becomes a willful violation. So, and those fines are pretty hefty. So we've got to do that. You can build around that, and there's 7 elements for that. And the first one is management leadership, which reminds me of a quote, and I put that quote up here for you guys. Leadership is not about being in charge. It's about taking care of those in your charge. That is what a good leader does. We have to take care of our workers. A good leader, we have the title as a good leader. I mean, we can be that leader, but if you're not taking care of your workers, that to me is not a real good leader. I mean, you've got to take care of those workers, and that's the focus on management leadership. You've got to be a better leader. Work participation. Hazard identification and assessment, as I mentioned, you identify the hazard and do you assess it, and then either you can, we call it engineering controls. You can engineer it out. You can do administrative control, and then the last sort is PPE, is the way that works. Hazard prevention and control, and what you want to do is prevent that from happening, and then you have to kind of control that environment and mitigate that hazard that you identified. Education and training, that is a continuum that you have to do all the time. I mean, we have to train. How many of you guys do conduct training? Anybody?
I have in the past.
Okay.
There's only 4 of us, but,
Okay.
whenever a new one would come on board, or sometimes when we get interns, we train.
Okay. And have you been in training before as well? Okay. All right. It's a continued, that's why they call it continuing education. We've got to train. One of the topics that I do is hazard communication, which talks about your SDSs, your chemicals that you have on site, and that's required once a year for your employees. And what happens is the following year when I go to a client and we talk about HAZCOM, and I'm surprised that the employees sometimes don't remember what we talked about or talked about from the previous year, and they've slept since then. So, and we all do, and we're not expected to learn right off the bat and memorize all that information, but that's just the human nature is a lot of times we don't remember those things. That's why we got to continue to educate our folks. Program evaluation and improvement. You have to evaluate your program. If it's not working, then now that's the time to update your program and continue evaluating, because things change, conditions change, policies could change. Communication, coordination with host employers, contractors, and staff agencies. Do you guys deal with any of those?
You sorry, say it again?
Do you deal with any of the contractors or the staffing? Okay. Share with us your experience with which one do you do? The staffing agencies?
Well, I'll say contractors really, because we partner with different businesses like the electrical companies, the HVAC companies, and the plumbing companies, et cetera. And
So
we
we
have to
hire
hire
them.
those individuals.
Yeah.
Okay.
Well, they hire the individuals.
Okay.
We just
We interview them, hire them, and then decide where to place them. But we're not considered a staffing agency. We're more so considered a school.
Okay.
But
Okay.
I do the hiring.
So do you have any responsibility of training them before they go on site or wherever the,
When they teach the electrical class, we're in the
Okay.
electrical class with them. So I mean, we are familiar with it.
okay.
Yeah.
Okay. A lot of times, like staffing agencies, they, they'll call you and say, hey, I've got 5 employees.
Yeah.
They're experiencing HVAC. So then they give them to you, and then you're responsible for those employees. Now, a lot of staffing companies, what they'll do is they'll do some type of training to where when you call them, they say, I've got 5 guys that have been through training. We did an orientation, so they're ready to go. And then they kind of, swing them over to that company. But at the same time, you can get tied to the staffing company because in the event that employee gets injured, somebody's got to pay that injury, so then the staffing company says, oh no, I gave it to X, Y, and Z company. They're responsible for doing that training. So you have to kind of mitigate that from the beginning and figure out who's going to be liable for that. So
Yeah, we have that understanding. They are.
okay, good. Now OSHA's website, you can go to OSHA.gov, and there's a lot of tools in the OSHA website and for you to start your business in regards to the training for your employees. It includes on how to get started. Pretty simple. A safety and health program self-evaluation tool that's available to you. A safety and health program implementation checklist, and I believe that's in your handout. There's a checklist, and I have got this QR code that you guys are welcome to scan. There is a small business and health handbook that OSHA puts out for you guys. I would really like for you guys, before you leave today, is go ahead and scan that, and it may be in your little handout there. But that is a good book to have, and it looks like that right there. Yeah.
Oh, okay.
Yeah.
So the back?
Yeah. The QR code should be in the back. And if you scan that, this is the booklet that they're talking about. This will get you started, and it's designed for the general industry. And then they have a safety and health program audit tool. And then you can begin with just a small, basic program. You don't have to, be elaborate about your program. And just the main goal is to keep you guys safe. What can I do to keep our employees safe? And by the way, I didn't get your name. What was Tony? Tony, what do you do, Tony?
I'm a county judge.
County judge, okay. And small business?
Yes, we're overall county, anything that pertains to the county, any contractor
Okay.
that we either have working for us. But this is interesting. I come out of law enforcement, so
Okay.
Investigated industrial
Okay.
accidents.
Mm-hmm.
We show up on a scene, someone's either been killed or injured.
Right.
And the things that we find were interesting because there were, after everybody cleared out, we go to finding out there was probably lack of training or none, or
Right.
forklift accidents was
Mm-hmm.
one. We had accidental death where the kid was killed. There was no training, there was nothing, and of course OSHA comes in and does their part too.
Mm-hmm.
Cotton gins, same thing where you have, there's something dropped the ball, there's a slipping gap in training.
Yeah.
And that's usually where it happens, so.
Okay.
Yeah,
Good.
This is good stuff. Great
Yeah.
stuff.
I did some training yesterday in Lubbock County, by the way.
Oh, did you?
Yeah, so they're starting to do training. It's unfortunate that we have to wait till somebody dies to do training, and that's, and I understand that, sometimes budgets, but I'm telling you guys, if you take care of your folks, they're going to take care of you. We need to make them go home to their families. That's what we need to do. That should be our goal. A lot of times, when I talk to companies, they worry so much about OSHA and the regulations, and they're going to be there forever. They're not going anywhere. But if you take care of your employees, and they do the right things, and you do the right things to train them, provide the PPE that's required to do the task, and they go home, it's a win-win for everybody. Win for the employer, for OSHA, and for the employee.
Well, I joke with you that my husband was a stickler, but it's for purposes like that.
Yeah,
To prevent death or injury or.
Yeah. And I guarantee you can ask your husband, would you like to be a supervisor in charge of an employee that just got killed? He doesn't get paid enough to carry that load. That's way too much for any human being to carry. I mean, nobody wants to carry that, but it's unfortunate.
And where he's a warehouse manager now, they're all young, like our kids in their 20s, and, you know, they think he's mean, but he's doing it because he cares.
Yeah.
Because he's trying to prevent.
One of these days, they'll understand that, and they'll appreciate him for what he was doing. He's doing what we call enforcement. We have to enforce that safety policy, the safety PPE. Developing and implementing a safety program, expressing your documentations is good faith and commitment. You're making a commitment that you're going to keep your employees safe while they're under your guard. So make sure that we're doing that. Workplace self-inspection. It's an effective way to do it. I mean, and it's there in your booklet. It's on the OSHA website, in the OSHA Small Business Plan. And what you want to do is do a self-inspection of your facility. For example, SPAG. Can you guys name something at SPAG, in any of your facilities, that you may be concerned about in regards to safety?
I think for us, and our executive director likes to bring it up a lot, is the outdoor safety.
Okay.
He's not very professional in the way he goes about it, but I grew up in the neighborhood. I live just a few blocks away from our current workplace, and I'm more aware because I grew up around it. So it's just being safe. You know, we had a couple of vehicles get broken into, or someone was trying to get into them. And also just a safety issue as well, because sometimes, you know, you see a lot of cops down the street.
Right, yeah. So how do we fix that? If it were up to you to make the decision, how would you fix that?
Well, one thing that I appreciate about one of my coworkers on our lending team is, even though she's bigger than me, she'll call me and she's like, hey, there's somebody out here in the parking lot. Will you come out here? It's sad, but thinking to schools and stuff, you know, school shootings, I'm always running, you know, situations in my head. Well, if something were to happen, you know, people will think I'm crazy, but I'm like, I would grab a chair or something, you know. But I try to find something or find someone that can protect us and go out there and make sure that she's safe coming in. Even if it's just somebody walking by, it's always good to just take precaution because you never know.
What about a fence around the...
Fence? No.
They go straight through our parking lot,
Yeah, it's like a cut through. Short path.
Okay.
On a bike, you know.
Yeah.
I'm going to be less daunting than that. Rolling chairs. We replaced our house, and it wasn't a question, but I mean, rolling chairs in our conference room, and people touch it and get ready to sit down, and it moves.
Yep.
So I have not seen anybody, but the potential is there, right? And so if I could fix it, you know, replace the chairs, but we just got them. We're moving buildings, and maybe we'll change that, but the rolling chairs in our conference room.
Yeah.
Because they're...
I on it yesterday.
You did.
If that's how you really let me know, I want them.
You want the safety hazard, we'll give it to you.
But if you haven't seen it already, or if not, you're going to see this. You'll see somebody pull up a chair and then try to get up there.
That's what I did yesterday.
I about lost it.
Oh.
You climbed on a rolling chair?
Yes.
Oh my gosh. And fell.
Oh my goodness.
They're so easy to move on.
Yeah. See, and if we do training, when you got your chairs in, I would have done a quick training with our employees and say, by the way, we got some new chairs. They're brand new, but we identified a hazard. It rose and moves easy. I mean, you can fall. And I've seen people fall. So you're okay?
I saw her lying on the floor, and I was like, what are you doing? So we're going to address it, but...
Yeah.
We saw her tumble, and I swear Pia looked like she wanted to spank her. But
So what you just did, you identified a hazard already. So now we got to do something about it now. And that's what OSHA is saying is, if you identify it, let's fix them before somebody really gets injured and or killed. But yeah, we've got to do those things. Small business employers should conduct routine workplace self-inspections. And the best way to do that is to get your experienced workers. Those are the guys that have been around for a while. Those are the guys that can see the things. Lubbock County, you go get a Lubbock County employee that's been working for the county for 25 years, and those guys can tell you, the front-end loaders, you know, they can tell you, left and right, what's wrong with it. They can tell you about the skid steer. They can tell you about, the plant, the rock crushing plant, what those hazards are. One guy was asking, I don't know why we have to wear a hard hat. There's nothing that's going to fall from the sky. And I said, well, the conveyor's moving, it's throwing material. What if that rock shoots out and hits you on the head? He says, I didn't think about that.
Right.
But that's the reason that, they did an assessment and they said, you're required to wear hard hats because there is a hazard present, a potential hazard is present. And that's why you do that. So you identify the hazards and then you control the identified hazards. So you identified this trip hazard, now we've got to be able to control that. And the best way to control that, there's an easy fix for this. This is just temporary. They can spend money and buy a projector and put it up there and you get rid of this. That's an easy fix, right? That's what OSHA wants you to do in your workplaces, is to identify them and then fix them. The goal is to keep our guys safe. That's the bottom line. Monitor and evaluate and see how it's working. If you administer something or implement something and you still having employees get injured, for example, let's say that you're having 10 employees get injured a year. Then you administer something, a process or procedure or a piece of equipment, and then now you have 5 employees still getting injured. So now you've got to evaluate and you got to fix that because they're still getting injured, is what they're saying here. Then we can watch our business grow. I mean, you take care, remember that formula? You've got to be safe to have a healthful environment, and then your business can grow for the small business individuals. The OSHA checklist is intended for general industry, workplace industries. They're just a starting point, and anybody can do it, but I would recommend that you get your experienced workers to do that for you. We can surround ourselves with talent. Everybody has a talent. Use your strengths for that. Checklists can give you some indication to where you need to take it to, what level you need to take it as far as your safety program is concerned. These checklists are not inclusive, but not all checklists apply to your business. When you go to the OSHA website and download that booklet, they give you tons of checklists. And what they're saying here is you're not going to have to use all of them. Just customize it based on what your business is doing. So if, for example, the Lubbock County, they have a pit, a rock crushing pit, that wouldn't apply to SPAG and their procedures. It's totally different. So that checklist will not work for SPAG as it does for Lubbock County.
Well, and I'm going to say for our department, because we work with vendors and contractors or whatever, we have to go out and inspect some of the projects. And so the safety stuff is going to become part of what we need to do. We can't go out there in sandals on a work site.
Absolutely.
Or are you going out and they're building a house and you don't have a hard hat? So we do have to look at some of those things on our side. But yeah, so I didn't even think about, well, we did think about hard hats because we think they're cute. They're going to be they're going to make them pink and sparkly. So we want the hard hats.
Yeah.
Shoes, we just thought, I did, but not everybody having some shoes that will be appropriate for that.
Yeah.
Closed-toed shoes.
Yes.
So you're good, and you're identifying those hazards. So, and that's great.
It's not traditionally a SPAG function, right?
Right.
We're taking it on, and so we've got to then look at the things that come with it.
Yeah. Anytime you expose a worker to a condition, then that's when you need to implement that policy and procedure. Based on what I do as far as a trainer, a lot of times, I'm in an office setting, and then I go to a rock crushing pit. I've got to change my gear. I got to take my suit off, and I got to put a hard hat, steel-toed boots, visible vest, hearing protection. I mean, I'm still, gullible for injury. I mean, that doesn't make me special. I mean, it doesn't protect me. I've got to do the same thing they do. Here's a number for you guys. 5486. What do you think that means?
What'd you say? I'm sorry.
That number, 5486.
How many people get injured in a day in one organization? I'm just playing.
I figured it was injuries also.
Okay. You're close.
Months maybe?
Huh?
In a month maybe?
Okay, I wish.
In a week.
That number right there was the workers that were killed on the job in 2022.
Where? The United States?
The United States. 5,400 individuals died. That's the workforce that we deal with in the United States. So if you average that out in 365 days, that's 15 fatalities a day. So by the time we get done this afternoon, when the day's over, you'll have roughly around 15 fatalities in the United States. That's sad.
How long is that? How long has that been happening? I just want to know, if we're not reducing this number, then something's wrong. If every year
Yep.
this is happening, so how long has that number been running?
Since when the law came about in 1970.
70?
Yeah. Those were when OSHA came about and it was enforced in 70. So prior to that, I bet that number was a lot higher. So OSHA comes in and implements rules, now that has gone down. But like you said, I agree with you, why are they still dying?
Yeah.
And that's a good question. And the question would be, is that complacency? Employees not wanting to wear PPE, not wanting to do the right thing. When was the last time you guys went around the residence here in Lubbock and saw a construction site, those roofers roofing the roof of the house or of the hotel or buildings? Do you see them tied off? A lot of times they don't tie off. They don't wear the harness they're supposed to.
My next door neighbor getting a new roof done. I don't see them.
That's
Yeah.
supposed to be harnessed on the roof?
They're supposed to wear a harness.
On a residential roof?
Yeah, they have devices that you can put on a roof, and it's a tie down, an anchor. Anchor them to where if they fall, at least they're hanging.
Yes.
I mean, it's better than falling and to your death. So, what do you see at Lubbock County? I mean, based on those numbers. I mean, as far as like answer her question is why are they still dying? Why?
I'm Terry County, but
Terry-
the
okay.
same thing. Training, I mean, the lack of training, I think the awareness, we can keep that awareness up. Sometimes we train, but then we have a gap of a year we don't do, and then the awareness drops.
Mm-hmm.
We get, a lot of that, or
No.
I think some of the injuries come from rushing, trying to get it done and trying to get home. So it's,
Yeah.
one of the things I push for our commissioners also, because a lot of times they working alone.
Mm-hmm.
Sometimes it's important. This is kind of a little off subject, but it's them not returning home. They're thinking, hey, it's 5 o'clock. Oh my gosh, somebody already home, but they get a call at 8 o'clock at night from the spouse saying, hey, Joe didn't come home. Y'all working late tonight? I said, no, he's supposed to have been off at 5. Got off that maintainer or something.
Mm-hmm.
Because they're sometimes work alone and didn't check in at 5 and go out to the scene or something where they're at and find out they either had a heart attack or some mechanical injury and no one was there to help them or something. So
Right.
these are the things to
Right.
look out for.
Now, he said something that's interesting, and this may help, some of the small businesses, especially, when they're learning, is working alone. If you're working alone, if you're in trouble, who's going to call 911? So it's better to work in pairs. That's why our first responders, they always work in pairs. I mean, because if, for example, if you've got a manhole, which is we consider a confined space, if they're going into that confined space, you got to have an attendant here in the event something's down there, like gas. If an employee goes in there and there's gas, he's overcome by a gas, how's he going to get out? We've got to think about those things, those are hazards for that employee. A lot of times that happens. So that's 15 fatalities every day, and the rules are there. I think it just has to come down to enforcement. Cindy, you talked about your husband. That's what he's doing in a way. He's enforcing those rules because he knows that workforce that's younger now, he knows that they've got a long ways to go and a lot to learn. And we've got to train, and that's what he's doing. Indirectly, he's doing a lot of training because he's been around it for so long that he knows. So the QR code's in your booklet. So if you guys want to download that, I would suggest you download it, and that's just the starting point for a small business. If you think about it, small businesses, there's not a whole lot of funds when you're starting a business, because everything costs money and it's so expensive. So when you start a small business, then you want to have as much funds as you can in the event something happens. But this will just get you started, and I don't recommend you go in there and just do everything at one time. I mean, do what you can, but you have to have some kind of a implementation of a safety program for your employees. Remember, the goal is to get your employees back to their homes where they belong. So start a business is a lot, but safety is the last thing and the first thing. When we start cutting budgets, safety is the first thing that goes away. But unfortunately, and that's why those numbers are still there. I know I saw your expression is why they're still dying. Well, that's why we're here, is trying to minimize that. And man, I wish if one person died a year, that's one too many.
It's too many.
It's one too many for me. Can you imagine if it was one of us, my siblings, or a family member, But it's out there. There's hazards out there. There's nothing wrong with working in a facility or a manufacturing company or any type of job. There's nothing wrong with doing that work. It's just you have to do it safely. You have to take care of you. Nobody's going to do it for you but yourself. So, all right. With that, does anybody have any questions in regards to OSHA rules and standards? Okay. Cindy, and going back to the HR department, and you're going to have your hands full, especially if an employee has an injury, because now OSHA have set rules that if they're injured, or 3 or more, you have to notify them within 24 hours. If there's a fatality, you have to notify them within 8 hours. So there's rules, and you can go to the OSHA website, and they give you all that information so that you can comply with the standards. Okay. Any questions? Okay.
You just said the rules that's for any organization. It doesn't matter what the organization is. Anybody that has one fatality, they have to do this within a certain amount of time.
Yeah. Well, yeah. If you have 10 employees or more,
10 or more,
then that applies to you. Yeah. If OSHA has to come out, they're going to come out, especially if there's a fatality. They want to find out what happened. So as a new employer, you want to do that. Now, SPAG's been around for a long time. Can SPAG have an injured employee? I'm sure depending on what they're doing. If somebody almost fell with a chair, or somebody had an incident with a chair, let's put it that way. But it goes to show you, anything can happen anywhere to any of us. It doesn't matter what it is. One of the things that gets me is when I'm on the road and I see the cell phones. That's a real distraction. I see it at workshop, facilities. That means you have to train. You have to train to keep these guys safe, the workers safe. All right. Then that's all I have for you guys today. You have my information there. If you have any questions that I can help you, feel free to call me and I can assist you. R2M does consult. If you need some help with any kind of safety programs, to write a program, then we're the guys. We can do all that. If you have an OSHA, if you have a fatality, or if you have an inspection, then we're the guys you can call, and we can abate those and help you guys out.
I had no idea. I knew we use you for environmental, but
yeah. But we do it all. Well, I appreciate you guys coming.
Thank you.
Thank you.